Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. And welcome back. Today is April 20th, 2020. And a tragic thing happened yesterday where 18 people were killed in Nova Scotia by a gunman who posed as a police officer. And among the 18 was an RCMP officer who died in the line of duty. She's a 23-year veteran of the RCMP, and she was shot and killed. Another officer was injured and is currently recovering from injuries. We did manage to find a GoFundMe account, and if you do a search supporting the family of Constable Heidi Stevenson, you should be able to find that GoFundMe account. And if you have anything to contribute to the family in their time of loss, please do. Along with the address that you're about to hear from Justin Trudeau, I'm probably not going to play the part that he asked us in the media not to mention the gunman's name, not to give him the attention that he might be seeking through this, and to focus more on the families and the loss of life. And that is what I'm actually trying to do with this current message. Along with that, Justin Trudeau, in his address, he was asked several questions about how to get Parliament working again and how to make things work here in Canada once again, because people are wanting to get business going again and know the government is back in action and all that. The Conservative Party did shoot down the idea of having virtual Parliament sessions as proposed by the Liberals, and was actually agreed upon by the Bach Party and the NDP, but the Conservatives didn't like the idea, so they are working out how to have Parliament return to session. So let's hear what Justin Trudeau has to say in these clips. Okay, hold on.
Bonjour tout le monde. Hello everyone. We are a country that stands united in our effort to defeat a pandemic, to save lives, and to help each other make it to a better day. But yesterday, we were jolted from that common cause by the senseless violence and tragedy in Nova Scotia. A gunman claimed the lives of at least 18 people. Among them, a woman in uniform, whose job it is to protect lives even if it endangers her own, Constable Heidi Stevenson of the RCMP. Constable Stevenson died protecting others. She was answering the call of duty, something she had done every day when she went to work for 23 years. This happened in small towns. Portapique, Truro, Milford, and Enfield are places where people have deep roots, places where people know their neighbours and look out for one another. There, everyone knows a Mountie because they're everything from police officers to social workers to teen counsellors. Now these communities are in mourning, and Canada is in mourning with them. to the grandparent who lost a child, to the children who lost a parent, to the neighbor who lost a friend. We are so sorry for your loss. Such a tragedy should have never occurred. Violence of any kind has no place in Canada. We stand with you and we grieve with you, and you can count on our government's full support during this incredibly painful time. Hier, au moins 18 personnes ont perdu la vie à la suite d'une fusillade survenue en Nouvelle-Écosse, plongeant des familles et leurs proches en deuil. Aux grands-parents qui ont perdu un enfant, aux enfants qui ont perdu un parent, aux voisins qui ont perdu des amis, mes pensées et les pensées de tous les Canadiens vous accompagnent. Une telle tragédie n'aurait jamais dû se produire. La violence n'a jamais sa place dans notre pays. Nous partageons votre deuil. Nous sommes de tout cœur avec vous alors que vous vivez des moments extrêmement douloureux. I also want to wish a full and speedy recovery to all those injured, including another RCMP officer. Canada is a vast and sweeping country, filled with long stretches of lonely roads. With unwavering courage and compassion, our Royal Canadian Mounted Police patrol these roads to keep us safe, as they have for over 100 years. I know that from coast to coast to coast, the women and men who wear the red serge in service to Canada are grieving deeply the loss of one of their own and one of our best. This tragedy is a painful reminder of the risks all of our first responders take to keep us safe, of the sacrifices they make every single day to protect our communities. Paramedics, doctors, nurses, firefighters, and police officers, they're always here for us. They've been stepping up through the pandemic, and yesterday in Nova Scotia, they showed that bravery. I want to take a moment to thank them all for their professionalism and their courage. Many of you are already working overtime because of this pandemic. Our communities need you now more than ever, and I know that can weigh on you at times. These are exceptional circumstances, yet you did what you always do. You ran towards danger. Without pause, without hesitation, you put your life on the line on behalf of all Canadians. Thank you for your service. Je veux prendre un instant pour remercier tous les premiers intervenants pour leur courage et leur professionnalisme. Vous travaillez déjà très fort à cause de la pandémie. Plus que jamais, on a besoin de vous. Et par moments, ça doit être une responsabilité qui est lourde à porter. Malgré les circonstances exceptionnelles, vous avez fait ce que vous avez l'habitude de faire. Vous n'avez pas hésité à risquer votre vie pour sauver celle des autres. De la part de tous les Canadiens, merci pour tout ce que vous faites. This day is made all the more difficult because of the precious lives lost and the senseless act of one person. Just how could this happen? We may never know why. But we do know this. No one man's action can build a wall between us and a better day, no matter how evil, how thoughtless, or how destructive. Canadians are kind and generous. We are there for each other and we look out for one another. As families grieve the loss of a loved one, all Canadians are standing with them. The pandemic will prevent us from mourning together in person, but a vigil will be held virtually to celebrate the lives of the victims at 7 p.m. on Friday through the Facebook group Colchester Supporting Our Community. As we learn more about what happened yesterday, it's important that we come together to support communities. In the hours since the tragedy, I've spoken with Premier McNeil, RCMP Commissioner Lucky, Minister Blair, and many Nova Scotians, including our Nova Scotia caucus. We will continue to work together to see this through. I know that people have a lot of questions. This is an ongoing investigation, but I can assure you that the RCMP and local authorities will keep you updated. I want to ask the media to avoid mentioning the name and showing the picture of the person involved. Do not give him the gift of infamy. Let us instead focus all our intention and attention on the lives we lost and the families and friends who grieve. Bien que la pandémie nous empêche de nous recueillir en personne, une vigile virtuelle aura lieu en ligne à 19h vendredi sur le groupe Facebook Colchester Supporting Our Community. Ce sera l'occasion pour nous de célébrer la vie des victimes et d'être là pour leurs familles et leurs proches. J'espère que vous serez nombreux à vous joindre à nous. Alors qu'on cherche à comprendre ce qui s'est passé hier, on doit être là, les uns pour les autres. Depuis la tragédie, je me suis entretenu avec le Premier ministre McNeil, la commissaire de la GRC, Brenda Luckie, le ministre de la Sécurité publique, Bill Blair, et notre caucus de la Nouvelle-Écosse, entre autres. Nous allons continuer de travailler ensemble sur ce dossier. Je sais que les gens ont des questions. L'enquête est toujours en cours, mais je peux vous assurer que la GRC et les autorités locales vont vous garder au courant des derniers développements. Je demanderai aussi aux médias de ne pas utiliser le nom ou les photos de l'auteur de ces actes terribles. Ne lui faisons pas ce cadeau. Concentrons-nous plutôt sur les victimes et leurs proches. I want to close today by addressing all the kids in Nova Scotia and right across the country. I know the world can seem like a mean and ugly place right now, but there's a whole lot of good in the world too. You'll see it in your neighbors and in Canadians in the days and weeks and months ahead. This is a difficult time, and it can be a scary time too. But we're here for you, and we're going to get through this together. I promise.
Mr. Prime Minister, I wanted to ask you, Conservative leader Andrew Scheer today accused you of being inflexible in your negotiations about the number of in-person sittings in Parliament. I was wondering if there's any room for a compromise, 2 sittings per week, for example, given that moving forward may be preferable to no deal at all.
Look, I don't want to get into arguments with anyone today. We are working together amongst all parties to try and figure out a way to both protect and uphold our democracy, to ensure that there is proper accountability, while at the same time doing that responsibly. And I am hopeful that we're going to be able to come to an appropriate arrangement.
Follow-up question?
I was wondering if we could have an accounting of all of the ways that the opposition has been kept informed of the ongoing crisis and the government's actions outside of the House to date.
As I said, we have been engaged with all parties over the course of this pandemic. There have been many good ideas brought forward by business leaders, by community groups, by individual Canadians, but also by MPs from all parties who've heard from citizens in their communities what's needed to be done to help. This has been an unprecedented effort across government to try and make sure that we are giving Canadians the help they need to get through this difficult time, and we will continue.
Next, in British Columbia, John Horgan also addresses what happened in Nova Scotia, and he says that Victoria, at the Capitol building, of course, in Victoria, that they would be flying the Nova Scotia flag in memorial of those who were killed and injured during the shooting. He's also addressing the plan for health care for rural and indigenous communities to improve the services and ensuring better health care for people who live in rural communities, and especially for those who are in First Nations that may have to travel quite far to get health services. So let's see what John Horgan and his ministers have to say about Indigenous health and rural communities. Here we go.
Thank you, George, and thank you for being here today. We, of course, in Victoria are assembled on the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations. Susan Wanamaker is in Vancouver at our offices there, which is the territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. At the outset, I just want to acknowledge, as all British Columbians mourn the tragic deaths of so many people in Portapique, Nova Scotia, including the loss of Constable Heidi Stevenson, a 23-year member of the Royal Canadian Mounted Police. All British Columbians' hearts are just heaving with sadness at a time when we are already enduring some of the most extraordinary times of our lives, to also have to hear of tragedy and unthinkable violence against fellow Canadians is just really, really tragic. Today, the Nova Scotia flag will be flying at the BC Legislature, and the Canadian flag will be at half-staff in the memory of those that were lost, as all Canadians mourn the tragedies that took place across our country on our far coast. I want to thank Minister Fraser for joining us today, as well as Dr. Daniel Bain-Smith, the Deputy Provincial Health Officer, and in Vancouver, as you've already heard, Susan Wanamaker, the Executive Vice President of Provincial Health Services Authority. COVID-19 continues to be the largest challenge of our time, and we continue to adapt day by day to ongoing operations of government, ensuring that we are making changes that are appropriate to provide services for people, but also all the while looking at how we can improve the delivery of those services wherever people may live. Every community in BC is working hard to keep people healthy and safe. Our efforts to break the curve and to bend it to a place where we can start to reintegrate into a more normal way of life is just around the corner, but it is a way away. That doesn't mean we shouldn't stop looking at how we deliver those services. And people living in rural, remote, and Indigenous communities have unique challenges accessing the health care that they need. Many people who are sick have to travel for hours to see a doctor. COVID-19 is adding pressure to an overburdened system. When there's travel to urban centres to get care, there are also costs that go with that. Hospitals, sometimes airline flights, buses, cars, gas, expenses. That adds to the stress for families who are already dealing with a health emergency. Many Indigenous peoples aren't able to access culturally safe and appropriate care when they leave their communities and go to larger centres for acute care. Minister Dix and Minister Fraser have been working on delivering primary care in rural, remote, and Indigenous communities since the day we were sworn in as a government back in July of 2017. Because everyone in BC deserves to have health care services delivered close to where they live. And if we can't build the facilities in rural and remote communities, we should make sure we have the ability to take citizens to those facilities. And today, I'm announcing a new collaborative framework for health care in rural, remote, and Indigenous communities. This will help immediately in our response to COVID-19, but the building blocks of this primary care initiative started, as I said, 3 years ago, and we've been working on it ever since. The emergence of the pandemic only highlighted the importance of ensuring that we have in place programs and policies that will make all British Columbians equal when it comes to accessing their health care. So what do we do to provide better supports into the future? The framework includes improved medical transportation options, which includes planes, helicopters, and 55 new ambulances to bring people from remote communities into urban centres where they can get the health care that they need. People in rural, remote, and Indigenous communities won't have to worry about how they get there anymore, and that will relieve some of the burden emotionally as well as the burden financially. And we're committed to moving patients at a moment's notice, particularly at this difficult time of COVID-19. The framework also includes self-isolation accommodation close to hospitals, faster and culturally appropriate COVID-19 testing methods. And Dr. Bain-Smith will talk about that, as will Susan Wanamaker. Also, an acceleration of enhanced virtual health care. We are making great strides in British Columbia, led largely by the private sector in partnership with our healthcare deliverers to make virtual healthcare a thing of our present, not just a thing of our future. It allows us to spread resources farther afield to make sure that people in every corner of British Columbia can get access to the quality physicians, nurse practitioners, and other healthcare providers here in BC. I want to say thank you, a huge thank you, to everyone who has worked on this, particularly Mr. Fraser and Minister Dix for making this a high priority for their ministries, but the First Nations Health Council, the Rural Coordination Centre of BC, our regional health authorities, particularly Northern Health, and of course the Provincial Health Services Authority, all working together with people on the ground, rural, remote, Indigenous, non-Indigenous communities. By continuing to work together, we'll be able to get through this particularly challenging time, and our healthcare delivery, our primary health system in British Columbia will be the stronger for it. I've said many times that out of this crisis and out of this tragedy for many, many people, whether it be their businesses or their families or their communities, we will be invigorated. We will be stronger as a result of the efforts we're taking today. This is one of those steps. And I'll now pass the podium over to Minister Fraser for a few comments, and then we'll move over to Dr. Bain-Smith for some of the details on the appropriate testing and other issues that she's been working on. Thank you very much.
Thank you so much, Premier. Good afternoon. It's a pleasure to be here with all of you. I want to acknowledge the Lekwungen-speaking people, Esquimalt and Songhees First Nations, for allowing us to do our business today, and I'm grateful to do this work on this beautiful island and this beautiful territory. The framework we are announcing today is important for all communities in rural and remote British Columbia settings. And I want to acknowledge that Indigenous communities, especially those in isolated areas, have unique needs and circumstances in the face of the pandemic. Ever since settlers began arriving here about 150 years ago, Indigenous peoples time and again have been hit much harder by diseases and pandemics, and that has left lasting effects and fears. I have talked with many First Nations and Métis leaders in the past few weeks. They have shared their concerns about protecting elders, the knowledge keepers, and everyone in their communities, because many are vulnerable. They face challenges accessing health services, health conditions that put them at a higher risk, and often crowded housing situations in the communities. And I'm seeing how much we've learned. For Indigenous and all rural and remote communities, each one has unique needs, and help must be responsive to those needs. That is what this framework does. For many weeks now, we have been working across governments and across agencies to support Indigenous communities in their preparations. This is all hands on deck. And I'm seeing how much we've learned from working together on recent emergencies like wildfires and flooding. Our emergency response on COVID-19 has integrated First Nations and Métis like never before. It is about working together, government to government. And I want to take a moment to acknowledge the First Nations Health Authority and Indigenous Services Canada in this work. Their responsiveness and their dedication to safeguarding and supporting communities has been unwavering. Guidance with pandemic planning, critical supplies like personal protective equipment and food, coordinating staffing and training for health providers in communities, and of course funding. The measures in this new framework bolster the supports of all rural and remote communities, prioritizing rapid testing, accommodation where people can self-isolate both in community and in larger centres closer to hospital, and medical transport that will be there in their time of need. These are critical supports to all isolated communities in British Columbia. I will close by saying that I have heard enormous gratitude in my conversations and for the support for support from Indigenous leaders for the amazing work of Dr. Bonnie Henry, Minister Adrian Dix, and Daniel Bain-Smith, and everything they've been doing. And as they've been telling us, we must continue to abide by the measures like social distancing to slow the spread. We are flattening the curve in British Columbia, and though we have not seen significant outbreaks in rural and remote communities yet, we must be ready, we must be vigilant, and that's what this framework is all about. It helps us to do these things as we face this pandemic together. I would also now like to introduce Dr. Daniel Bain-Smith, our Deputy Provincial Health Minister of Indigenous Health, up to the podium to share some words of wisdom with you. Thank you very much.
Bon après-midi. I'm Danielle Bain-Smith. I'm Etchodene from Fort Nelson First Nation, and I'm French-Canadian and Métis from the Red River Valley in Manitoba. I'm extremely grateful to be speaking to you today from the territories of the Lekwungen peoples. Our people have been healthy, balanced, and well for thousands of years. Since contact, we've shown our strength and resilience time and again against deliberate attacks on our ways of knowing and being, our culture, our language, the things that make us distinctly Indigenous. And we have faced ongoing systemic and structural racism and discrimination. As a result of colonial practices and policies, we come into this epidemic on unequal footing. An ethicist colleague of mine noted that coronavirus doesn't discriminate, but systems can and do. I believe that COVID-19 and our collective responses have the potential to promote equity rather than disparity if we come together with one heart and one mind with diverse Indigenous peoples. The work described here today is an excellent step in that direction. Earlier detection of cases with newer, faster testing and informed choices about access to higher levels of care will help decrease the impact of COVID-19, which, as noted by Minister Fraser, has the potential to be culturally devastating. Elders are the heartbeat of our community. They're our link to our ancestors, our teachings, and we need them to ensure cultural continuity. In addition to this great work, there are 3 other considerations that must be hardwired into our responses if we want to achieve equity. The first is that we must use distinctions-based approaches that honor the unique and diverse experiences amongst Indigenous peoples. Recognizing that First Nations, Métis, those living in rural, remote, and urban areas are different from each other and bring different perspectives and needs. Secondly, we need to hear and respond to the stories and needs of Indigenous women and girls, who we know, as a result of the Missing and Murdered Indigenous Women Girls Report, face higher rates of violence, which have only intensified during this stressful time of self-isolation. And finally, we need to use robust tracking using both Western and Indigenous data to illuminate whether COVID-19 responses are meeting the needs of Indigenous peoples in culturally safe ways. By this, I mean it's not just about the services we deliver, it's about how we deliver them. As healthcare providers, we need to be aware and respectful of the uniqueness of BC's diverse Indigenous people. Cultural identity is fundamental to our health and wellness, and it must be respected. In collaboration with First Nations Health Authority, Métis Nation BC, and BC Association of Aboriginal Friendship Centres, and others, our office is working to uphold Indigenous data governance principles and help create a clear picture of how COVID-19 is impacting Indigenous peoples in BC. I've been truly awestruck by the collaboration and relationship building that's taken place over the last number of weeks. During this unprecedented time, there are unprecedented opportunities to advance reconciliation and Indigenous self-determination. I'm hopeful that on the other side of this crisis, we can tell a story of how we came together in meaningful partnership with diverse Indigenous peoples to ensure equity, decolonization, and cultural safety. Masi Cho. I would like to now introduce Susan Wanamaker, Executive Vice President, Clinical Service Delivery with Provincial Health Services Authority. Masi.
Thank you. Please go ahead, Susan.
Good afternoon, everyone. As I'm joining today's event from downtown Vancouver, I would also like to start by acknowledging that I'm privileged to be presenting on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm delighted to be part of this announcement today. For the work we are announcing, for the meaningful collaboration it represents, and for the meaningful access to care this means for people living in rural, remote, and Indigenous communities. Throughout my healthcare career, I've been privileged to work with different healthcare providers across the province, and I've seen and experienced the impact of timely access to care at every stage of the patient's journey. There's no denying that when it comes to access to care and access to critical care, be it related to COVID-19 or other life-threatening situations, that minutes count. And not just for our patients, but for our care providers themselves, who understand that the positive impact they might have on someone's life often increases the sooner the patient's transportation can be merged with the care at hand. As we've heard, we are managing in a new reality in the midst of COVID-19, and this has sparked forward momentum on much-needed transportation resources that will serve our patients both short and long term. As Premier Horgan has already shared, today's announcement involves a number of tangible service improvements for British Columbians living in rural and remote communities. With respect to BC Emergency Health Services, this involves significant additional resources for our transport fleet, including 55 additional ground ambulances across the province, and to highlight, 5 of those will be put into the Northern Health Authority, and 5 additional provincial air resources, both fixed wing and rotary, with others as we need. Initially, this expanded network was activated as part of the COVID-19 surge planning, enabling and supporting the swift connection of people living in rural and remote to higher levels of care. But thanks to thoughtful, evidence-based planning with partners across the province, these resources will remain in place long-term, ready for repositioning as required to meet local needs. PHSA and BCEHS are excited to be working as part of this partnership with the BC government, with our regional health authorities, with the First Nations health authorities, and our Indigenous leaders across the province. As we shift from surge service delivery to implementation of long-term resources, we are actively moving on the next steps. This includes continued engagement and collaboration with the health authorities, First Nation health authorities, and our other Indigenous partners. Human resource planning and implementation is critical, as is engagement with our union partner QP 873 as a key component of this. Our team is truly excited at what this announcement means for rural and remote communities, our patients and families, and our paramedics. In closing, I'm mindful of a well-known African proverb that rings true today. If you want to go fast, go alone. If you want to go far, go together. Arguably, we are also moving fast in light of COVID-19, but the partnership behind today's announcement means our expansion of BCEHS services will be impactful and lasting. Finally, I'd like to thank the government, the Ministry of Health, for your leadership on this. And I would also like to offer my sincere appreciation to everyone who's been involved and look forward to working together. Thank you.
It would seem that John Horgan and his government, they want to work together with all the communities and work and build a unified community throughout British Columbia to ensure the best welfare of everyone who lives here. So we want to thank John Horgan for that message. And next is Eunice Joseph, and she is a graduate student in the library sciences, and she's going to give us some tips on how to use the library even if the building is actually closed. Because what I didn't know, and Eunice kind of taught me this, was that there is a whole library that we can access, download entertainment, audio books, reading materials, and so forth from a online library using the proper resources. So Eunice Joseph is next with those tips. Here we go. Welcome back, everyone. I'm here today with Eunice Joseph, and Eunice responded to a Facebook post that I put up about accessing free resources so that we can grow our minds, our families, and not stay so bored and just binge watch TV while we're locked away in self-isolation during this COVID-19 pandemic. Welcome to the show, Eunice. Now,
Thank you.
You're with the kind of with the public library, or speaking about the public library with things, right? Aren't you?
Yes. So I have my first experience of working in a library was an academic library while I was doing my bachelor's. And then I have over 15 years of work experience with public libraries. And currently I'm working on my master's degree. So what I'm giving you is a perspective from a grad student, but I can tell you all the different things that public libraries offer to people.
Oh, so what are some of the really big things that we can get from the public library? I remember, like the university libraries, you got access to all these databases and articles where you could research all kinds of really weird articles for papers that you had to write for school. But
you can still do that with the public library. You can, but it's not as academic. So you're right. They will purchase a lot more academia material, whereas public libraries won't buy as big of a package. EBSCOhost is the biggest digital database for journals. So
yeah,
you can access that through the public library. Right now, I wanted to say, with the pandemic and people being self-isolated, it is frightening for a lot of people. And what I thought, why I approached you, Michael, is because I thought, well, this is one way that I can help. I'm not a medical professional. I'm not on the front lines, but I know resources at public libraries, and it's a great time for people to kind of self-evaluate and decide, okay, well, I've got this time. Yes, things are tough, but what can I do that will make me feel like I've done something? So public libraries right now are offering, even though the doors are closed physically because of the pandemic, you can sign up for electronic library cards, e-library cards right now. There's a push from public libraries to do this, to meet the demand of people accessing digital resources. So I wanted to start off by saying that public libraries offer ebooks and audio books that you can stream for free. So it's not just databases like we had spoken about earlier, but it's fictional books that are quite popular, or nonfiction books that something that you're interested in, like say cookbooks or knitting or biographies, that sort of thing that they offer, as well as music, which I don't think a lot of people know about, but you can stream music through the library database. And then one thing that public libraries are doing more frequently now is they're offering streaming of videos or television series for free. So for instance, Acorn Media has granted a license to public libraries, and you can stream BBC shows and shows from New Zealand and Australia, as well as there's another database, Canopy, that you can stream documentaries from. So there's a lot of options there for people. I would just take a look at your public library website. It's free. And the role of public libraries is to protect people's intellectual freedom. So there's a lot of power to the people by accessing these resources.
Yeah, I know you mentioned a couple of things there that I like ebooks, because as doing radio and podcasting, I have to read a lot of people's books.
Mm-hmm.
But if I wanted to like read some of my favorite novels and stuff like that, I really don't have the time to actually pick up a book and read some of my favorite novels, but I'll listen to them as an ebook. And
ebooks are fantastic.
Yeah,
e-audio too. Yeah,
yeah. And the thing about it is that the sound versus them being a movie or something like that is like I can still picture it in my mind the same as though I was reading the book, right?
Yeah, it's especially nice when the authors are reading it themselves because of the tones, and they know where to break. And I just find it quite enjoyable. And you don't, well, for instance, let's say you're driving. You don't feel like you're stuck in traffic if you've got an e-audiobook, right? Or some people listen to e-audiobooks when they're cooking. So there's a lot of options out there, a lot of that people don't know about.
You mentioned video and documentaries, because I get a kick out of film festivals and things like that, which it looks like we're not going to have very many film festivals this year because we have to self-isolate. Yes. And the documentaries that show up at the film festivals, they're absolutely phenomenal. And you're saying that we'd be able to access documentaries that way?
Yes, documentaries. And then you also triggered something in my mind when you were talking about film festivals, because there's another database that you can access called IndieFlix, and that is part of RB Digital. RB Digital does magazines, they do ebooks, they do e-audio, but they also do independent films. So if you're interested in independent films, documentaries, that's another database that I could recommend.
Yeah, indie films are really cool. Because I do. Well, I've been involved in a couple of indie films myself, behind the camera, or editing a soundtrack or something like that. And I mean, the perspective on the story with the indie film is it's not like how to put it, when it's not as, hey, I got to make a bunch of money off of this to pay for this budget. Sometimes because it's a lower budget, that they can actually focus more on the integrity of the story, right?
Yeah, it's just beautiful. You can learn a lot about people from watching independent films, things that don't get as much play in big theaters. So yeah, it's worth having a look.
So, I know that they've done a lot of work with bringing online classrooms to the kids, because the schools themselves are closed again. Everybody's in close proximity, and we can't have that right now.
Yeah. No.
So the schools aren't open. So with the public library being able to go online and have resources online, will it help? Is there a way that we can use that to help tutor our kids, to help them get their lessons done?
Well, some public libraries offer. They have contracts with Homework Help. That's one organization. It just depends on the library system. So there are some library systems that do offer tutoring options. It's not library staff, it's actually educators that are providing the tutoring. That's an excellent option there. And then also the databases. There's databases for kids. There's encyclopedias you can access. There's books for kids that you can access. So there are, public library does have items for children as well to help them through with homework.
Yeah. Very cool.
So it is really interesting.
It sounds like the whole world of the library that would be in the building is actually online also.
Yes. Yeah. The libraries, public libraries, because of funding, they're funded by the government.
Mm-hmm.
There's been digital content is a lot more expensive than hardcover books. So sometimes people are frustrated because they weren't able to access as much items digitally. But there was a campaign through the American Library Association bringing awareness as to how much an ebook costs to a physical copy. But with the pandemic, a lot of libraries have reallocated their funds and they're pushing towards the digital content just to help service people. So if you weren't satisfied with what you had seen at a public library before, I would check again because there's a lot of things that have been opened up. A lot of the vendors have opened up things as well to public libraries. So it's interesting how this pandemic is, there's a lot more, it's changed things, how we look at things, right? So, yeah, I would just have a look.
There's been a lot of changes. I'd say that the pandemic has thrown our society on its ear and then turned us over a couple times, but it's sounding like the library changes with online resources is going to be a more positive thing that needed to happen anyway.
Mm-hmm. Well, libraries historically, now I'm putting my grad student hat on. Libraries historically have always adapted to change in society. They have to in order to survive. Otherwise, public libraries, people will say, well, why should we fund them? They're not doing anything. So there's always been a history of libraries having to adapt. Some of us can't adapt as quickly as we would like to because of funding. But digital resources have been there for a very long time. It's just a lot more awareness is being brought. A lot more people are using it. A lot more people are able to buy the devices themselves. Because some libraries do lend out e-readers, but not a lot of library systems can afford to do that. So as people were able to buy their own tablets and iPads, it just increased the demand for more digital content.
Yeah. You were talking about the library adapting and changing with our society's needs. Isn't it true, like that there was a public library system in ancient Egypt?
Yes. Yeah. Yeah. Library's been around for a very, very long time.
It's definitely not a new idea, but it's always been a resource of documentation throughout history, right?
Mm-hmm. Yeah, and how information was organized and how it was shared. Right? There's a lot of power into saying who can access what material, right? So when I talk about intellectual freedom, public libraries are on the front lines of protecting that freedom for people. There's a lot of issues with censorship. Communities have, or governments have, as in the States, have said, okay, we don't want children reading this material, and if a public librarian recommends it, well, either their funding is going to get pulled or the librarian can go to jail. Right? So it's an ongoing battle with censorship.
Yeah.
But intellectual freedom is something for all of us, and it's a way to empower ourselves. We need to mentally grow, and we can learn skills. Some of the databases that I wanted to talk to you about there's one called lynda.com, and has been bought over by LinkedIn. So LinkedIn has rebranded it, but I know it as lynda.com, and they offer a lot of free courses. Let's say you're not very familiar with Word, or you want to learn photography, or you want to do time management. this database is excellent. They've hired instructors that will walk through classes with you. So you can learn for free. You don't have to worry about paying a lot of tuition, right? If you want to freshen up on things or learn different skills.
That would be lynda.com?
Lynda.com, but always go through the library website because the library pays for this, right?
Mm-hmm.
Well, the funding comes from the government, but the library makes the decision, okay, we're going to pay for this database. So if you do it on your own outside of the library, Lynda.com will say, oh, well, you already have an account set up in the library. Go through the library. They will suggest it themselves because it's free that way. And there's also, we talked about EBSCOhost before with academic papers, but you can look up newspapers throughout Canada. Sometimes you can look it up internationally. Contractors, I was going to suggest, they would be interested in because you and I are speaking in British Columbia, there's the BC building codes that's available through the public library website. So contractors don't need to worry about whether they can physically access a copy. You can access it through the BC building codes. And then mechanics, there's the auto repair manuals. You can put in the model of your car, the year. And this is not just mechanics, right? It's people who can fix things. I can't, but I take my car to the mechanic. But for people who can fix things but just need a little bit of help, they have manuals online through the website. So you can look things up, you can print it. If you've got a printer at home, you can print it, or you can just look at it on your computer while you're fixing things. And then another one would be the vehicle safety manual as well. It's also online, small engine repair. So there's a lot of interesting things that people can access. And there's a lot more than what I know because each public library system offers different databases, right? And then for your business, people who are interested in building their business, there's the Small Business Accelerator database, there's Business Source Premier. Also, you can learn how to create business plans through the Small Business BC website. There are tons of options for people during this time.
Wow, who would have thought that all this could be held within the library? You know?
Yeah. Well, I think a lot of people have this idea of it's a warehouse of books. That's what we like to call it,
Mm-hmm.
right, in grad school. Warehouse of books. But it's more than that. The spaces are community spaces, so people either meet their classmates, like it's a safe place for people to meet. You don't have to buy anything to be in that space, like coffee shops, right, or restaurants. You can just go to a public library and walk in with your, you can take in food and drinks, right? So,
yeah, when the library is open locally here in South Surrey, that they have what's called the think tank,
mm-hmm.
and we've had a couple of board meetings in there because you got the whiteboards in there, and you take pictures of you scribble stuff all over the whiteboards, and you take pictures of it, and then we all go back and we digest even further about what we spoke about, and it's the library is just a community resource overall, right?
Mm-hmm, it is.
Yeah,
exactly. That's what it is. It belongs to the community. I can't stress that enough. If you feel that your library should offer something, please fill out that "How are we doing?" form or the comments form, because that goes up to the managers, mm-hmm. and the managers will also bring that up with the library board. So the more people from the community are asking for things and they're like, okay, we need to find a way to do this. Sometimes we are unable to do it because of physical space, mm-hmm. right? We can't add rooms, but we'll do our best to try and help people. we're in the service industry. We're guardians of knowledge, yes, because of the material that we have, but it's also a physical space. Everything belongs to the community.
Thank you for sharing. It's a wonderful resource. I've always gotten a really big kick out of using the public library or whatever library system I've been allowed to walk into, and there's you've brought up some things that I forgot about were in the library, or that I just didn't even know, and knowing that the website itself, like the online resources, are going to match a lot of that. Just says how the library is going to keep reinventing itself so that it serves us as a community.
Yes.
So
on the website itself, what I wanted to point out was therell be a link. They'll say "Ask a Librarian," and you can put your comments in there, and it's most of the time it's a live chat with a librarian. But if you have a question that you want to ask and you don't want to call in, but you just want to quickly type it in, and then you can start a dialogue with the librarian. And if they don't know the answer, they'll do their best to try and help you, because I'm speaking from the other end of it, right? If a librarian that you get doesn't understand, I will tell you that librarian will ask other librarians if they can try and find the resources that you need. So it's really just people just want to serve. That's basically what it is. If we can't do it, we'll try our best to help you, and then if we can't, we really can't. But what I also wanted to say was public libraries, there's the academic libraries, but there's also special libraries. And that's something I'm learning more about through grad school. For instance, there's law libraries. So public libraries don't have a lot of information about legal matters, right? Because we cover so many different subjects in one building or one building website. But law libraries, you can access specific information. They can't give you legal advice, but they would have a lot more legal information in their libraries.
Yeah.
And the same with military libraries, art libraries, just to name a few.
Yeah. So, exciting world lies for us inside the library, right?
Yes. Well, I'm biased because my mom took me to the library when I was a child, so it was planted in me as right from the get-go kind of a thing. So, but there's a lot of things that people don't know about. That's why I just thought, when I saw your post, I said, okay, I can do something, right? I can kind of contribute somewhere. Another thing I wanted to mention was when you are looking for information, especially at a time now when so much information is going on about the pandemic, don't just Google things. Try your best to find a credible resource. Look, for instance, if you're looking for medical information, first of all, always talk to your medical professional. I know clinics, are limiting the amount of people that they will see. There is 811 that you can call in British Columbia if you're looking for more health information, or 211 is just general information that you can just pick up your phone and call, and then they'll give you information from there. They'll give you reference resources and such. But if you're looking for medical information, WebMD is a good website. If you're looking for information about cancer, don't just Google cancer. Look at the Cancer Society websites, BC Cancer Society, because we're in BC, the Cancer Organization, diabetes, heart stroke. Just stick as far as you can with the actual professionals, because you want to hear what their information is, right? Michael, you understand from a science perspective. this is all proven, and yes, there's some things we don't know about, like this pandemic, but they'll give you the information that they can back up with science.
Yeah. Well, even with this pandemic, there is still some hard science into how they're actually dealing with it. So.
Yeah, exactly. I mean, it's all new, right? It's novel to all of us. But just try your best, because I think with Google, even when people, before all this had happened, people would say, okay, I've been diagnosed with cancer or I have these symptoms, and I looked it up on Google, and I'm just freaked out because it'll pull up all sorts of information, right? But just look at where that information is coming from. I can't stress that enough, because as a grad student, they're always honest about that. Like, don't just, Wikipedia it or Google it. You really have to look at the source.
Yeah, I do remember that they always got after us is like, did you validate your source?
Mm-hmm.
And it's something that it spills over to what I'm doing right now, with things that people send me, and I was like, okay, that if I can't validate it, I can't report it, right?
Mm-hmm.
So, and I'm glad you're inviting all of our listeners to make sure that they are validating something, and make sure that all the sources actually add up to what it is that you see in front of you. So, yeah. Mm-hmm.
Yeah, you don't want to be misinformed, right?
Yeah.
Especially now when the pressure's on about a lot of things, I would just really try your best, right? We can control ourselves. So try our best to do certain things that will help empower us, right?
Okay, yeah. Because knowledge is empowerment, right?
Mm-hmm. It is. Definitely is.
So, yeah. Well, thank you, Eunice, for joining us today.
Oh, you're welcome. Thank you for having me, Michael. I really, really grateful for this opportunity.
It's wonderful that you came on and explained some of the resources of the library and advised people to make sure that they are validating all of their sources when they start looking at things. So,
yeah.
Right. Thank you, everybody, for listening today, and we will talk to you next time. All right, thank you for listening, everybody. Have a great day. Be safe. Stay apart from everyone. Remember the 6 feet social distancing. And best of health and safety to everyone listening. Thank you so much. And thank you for listening to Depictions Media. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.